Welcome to Ariana Institute's Continuing Education Program. This is Ariana Vincent, Nationally Certified Massage Therapy Instructor and Continuing Education Provider. At Ariana Institute, we offer a wide variety of online continuing education courses for the massage therapist. Visit www.arianainstitute.com for additional information or contact Ariana Institute at arianainstitute.com. We look forward to your participation in our online continuing education program. Thank you. Welcome to Ariana Institute's Ethics Continuing Education course. This is Ariana Vincent. This course is accepted by the National Certification Board of Therapeutic Massage and Bodywork, as well as state boards throughout the United States. Ethics is defined as a branch of philosophy which seeks to address questions about morality, that is, about concepts like good and bad and right and wrong. The NCBTMB developed the standards of practice to provide a statement of the expectations of professional conduct and level of practice in the following areas: professionalism, legal and ethical requirements, confidentiality, business practices, roles and boundaries, and prevention of sexual misconduct. It is important to consistently maintain and improve professional knowledge and competence, striving for professional excellence through regular assessment of personal and professional strengths and weaknesses, and through continuing education training. According to NCBTMB, a massage therapist shall do the following in order to be in compliance with NCBTMB Standards of Practice 5, Roles and Boundaries: adhere to ethical boundaries, perform the professional roles designed to protect both the client and the practitioner, and safeguard the therapeutic value of the relationship. It is important, according to the NCBTMB Standards of Ethics, to provide draping and treatment in a way that ensures the safety, comfort, and privacy of the client. It is important, as part of maintaining an ethical practice, to accept responsibility to do no harm to the physical, mental, and emotional well-being of self, clients, and associates. According to the National Certification Board, the certificant or applicant for certification shall adhere to the ethical boundaries and perform the professional roles designed to protect both the client and the practitioner and safeguard the therapeutic value of the relationship. The following are part of NCBTMB Standards of Ethics 5. Recognize personal limitations and practice within the limitations. Recognize the influential position with the client and not exploit the relationship. Recognize the limit and impact of transference and countertransference. Avoid dual or multidimensional relationships and not engage in sexual activity. The following are part of the NCBTMB Standards of Ethics 5. Acknowledge and respect the client's freedom of choice in the therapeutic session. Respect the client's right to refuse the session. Refrain from practicing under the influence of alcohol, drugs, or illegal substances. Only perform breast massage or treatments in the anal canal as indicated in the plan of care after receiving informed voluntary written consent. Have the right to refuse or terminate service to a client who is abusive or is under the influence of alcohol, drugs, or any illegal substance. Refrain from participating in sexual relationship or sexual conduct with the client, whether consensual or otherwise. In the event that the client initiates sexual behavior, clarify the purpose of the therapeutic session, and if the conduct does not cease, terminate or refuse the session. Only perform therapeutic treatments beyond the normal narrowing of the ear canal and normal narrowing of the nasal passages and in the oropharynx as indicated in the plan of care, and only after receiving informed voluntary consent. It is not advisable to participate in dual or multidimensional relationships that could impair professional judgment or result in exploitation of the client or employees and or co-workers. Sexual activity could be defined as any verbal and or nonverbal behavior for the purpose of soliciting, receiving, or giving sexual gratification. According to the rules set forth by the NCBTMB, AMTA, and the Texas Department of State Health Services, and many other state boards, it is not permissible for a massage therapist to engage in any sexual activity with a client. Socrates was one of the first Greek philosophers to encourage both scholars and the common citizen to turn their attention from the outside world to the condition of humankind. Informed consent usually refers to the idea that a person must be fully informed about and understand the potential benefits, limitations, and risk of their choice of treatment. Three types of boundaries include personal boundaries that include boundaries that determine your personal, physical, emotional, and mental well-being, legal boundaries that relate to judicial rules and regulations, professional boundaries that are determined by many things, such as your type of practice and your business rules and practices. Codes of practice are not only for the benefit of the client, but they also benefit those belonging to the profession. The following can be found in the NCBTMB Code of Ethics. Conduct their business and professional activities with honesty and integrity, and respect the inherent worth of all persons. Refuse to unjustly discriminate against clients and or health professionals. Safeguard the confidentiality of all client information, unless disclosure is requested by the client in writing. The following can be found in the NCBTMB Code of Ethics. Respect the client's right to treatment with informed and voluntary consent. The certified practitioner will obtain and record the informed consent of the client or client's advocate before providing treatment. In Texas, the initial consultation includes the type of massage techniques, the parts of the body to be massaged and avoided, the statement that the registrant shall not engage in breast massage without written consent. Draping will be used unless otherwise agreed to by both client and therapist, and the signature of the client and the therapist. In many states, on each intake form, the following information should be included. The goal of this massage session is to decrease stress and muscular tension. You may choose to tell the therapist to omit any areas, and you, the client, will discuss prior to the session if you have any indications or contraindications. In many states, on each intake form, the following information should be included. Massage therapists are not qualified to perform spinal or skeletal adjustments, and they are not qualified to diagnose, prescribe, or treat any physical or mental illness. NCBTMB guidelines regarding sexual misconduct only perform therapeutic treatments beyond the normal narrowing of the ear canal and the normal narrowing of the nasal passages as indicated in the plan of care, and only after receiving informed voluntary consent. Only provide therapeutic breast massage if you have a signed release. AMTA Code of Ethics. Acknowledge the confidential nature of the professional relationship with clients and respect each client's right to privacy. Conduct all business and professional activities within their scope of practice. Refrain from engaging in any sexual conduct or sexual activities involving the client. It is advisable and sometimes required by your state board for a registrant to obtain the written consent of a parent or guardian to provide massage therapy services to a person under the age of 17. It is important to respect the client's boundaries with regard to the following: privacy, exposure, emotional expression, the client's reasonable expectations of professional behavior. This course was brought to you by Ariana Institute. It was prepared by Ariana Vincent, LMT, MTI, NCTMB. To register for additional courses, please visit www.arianainstitute.com. Thank you very much for participating.